Okay, technique and warnings. This is from Dr. Simeons, Pounds and Inches. All right, pay special attention. I must warn the lay reader that what follows is mainly for the treating physician and most certainly not a do-it-yourself primer. Many of the expressions used mean something entirely different to a qualified doctor than that which their common use implies, and only a physician can correctly interpret the symptoms which may arise during treatment. Any patient who thinks he can reduce by taking a few shots and eating less is not only sure to be disappointed, but may be heading for serious trouble. The benefit the patient can derive from reading this part of the book is a fuller realization of how very important it is for him to follow to the letter his physician's instructions. In treating obesity with the HCG plus diet method, we are handling what is perhaps the most complex organ in the human body. The diencephalon's functional equilibrium is delicately poised so that whatever happens in one part has repercussions in others. In obesity, this balance is out of kilter and can only be restored if the technique I am about to describe is followed implicitly. Even seemingly insignificant deviations, particularly those that at first sight seem to be an improvement, are very liable to produce most disappointing results and even annul the effect completely. For instance, if the diet is increased from 500 to 600 or 700 calories, the loss of weight is quite unsatisfactory. If the daily dose of HCG is raised to 200 or more units daily, its action often appears to be reversed, possibly because larger doses evoke diencephalic counter-regulations. On the other hand, the diencephalon is an extremely robust organ in spite of its unbelievable intricacy. From an evolutionary point of view, it is one of the oldest organs in our body, and its evolutionary history dates back more than 500 million years. This has tendered it extraordinarily adaptable to all natural exigencies, and that is one of the main reasons why the human species was able to evolve. What its evolution did not prepare it for were the conditions to which human culture and civilization now expose it. I guess that means the refined sugars. History taking. When a patient first presents himself for treatment, we take a general history and note the time when the first signs of overweight were observed. We try to establish the highest weight the patient has ever had in his life, obviously excluding pregnancy, when this was, and what measures have hitherto been taken in an effort to reduce. It has been our experience that those patients who have been taking thyroid preparations for long periods have a slightly lower average loss of weight under treatment with HCG than those who have never taken thyroid. This is even so in those patients who have been taking thyroid because they had an abnormally low basal metabolic rate. In many of these cases, the low BMR is not due to any intrinsic deficiency of the thyroid gland, but rather to a lack of diencephalic stimulation of the thyroid gland via the anterior pituitary lobe. We never allow thyroid to be taken during treatment, and yet a BMR which was very low before treatment is usually found to be normal after a week or two of HCG plus diet. Needless to say, this does not apply to those cases in which thyroid deficiency has been produced by the surgical removal of a part of an overactive gland. Hi, Ellie. It is also most important to ascertain whether the patient has taken diuretics, as this also decreases the weight loss under the HCG regimen. Returning to our procedure, we next ask the patient a few questions to which he is held to reply simply with yes or no. These questions are: do you suffer from headaches, rheumatic pains, menstrual disorders, constipation, breathlessness or exertion, swollen ankles? Do you consider yourself greedy? Do you feel the need to eat snacks between meals? The patient then strips and is weighed and measured. I've got a fly bugging the crap out of me. Sorry. Patient then strips and is weighed and measured. The normal weight for his height, age, skeletal, and muscular build is established from tables of statistical averages whereby in women it is often necessary to make an allowance for particularly large and heavy breasts. This doctor's got something to do with breasts, man. The degree of overweight is then calculated, and from this, the duration of treatment can be roughly assessed on the basis of an average loss of weight of a little less than a pound, say 300 to 400 grams per injection per day. Loss of weight of a little less than a pound a day. It is a particularly interesting feature of the HCG treatment that in reasonably cooperative patients, this figure is remarkably constant, regardless of sex, age, and degree of overweight. The duration of treatment. Patients who need to lose 15 pounds, or 7 kilograms, or less require 26 days treatment with 23 daily injections. The extra 3 days are needed because all patients must continue the 500-calorie diet for 3 days after the last injection. Now, this next thing I'm going to read is underlined, so it's very important. Excuse me. This is a very essential part of the treatment because if they start eating normally, as long as there is even a trace of HCG in their body, they put on weight alarmingly at the end of the treatment. After 3 days, when all the HCG has been eliminated, this does not happen because the blood is then no longer saturated with food and can thus accommodate an extra influx from the intestines without increasing its volume by retaining water. We never give a treatment lasting less than 26 days, even in patients needing to lose only 5 pounds. Okay, no more underlining. It seems that even in the mildest cases of obesity, the diencephalon requires about 3 weeks rest from the maximal exertion to which it has been previously subjected in order to regain fully its normal fat banking capacity. Clinically, this expresses itself in the fact that when in these mild cases, treatment is stopped as soon as the weight is normal, which may be achieved in a week. It is much more easily regained than after a full course of 23 injections. As soon as such patients have lost all their abnormal superfluous fat, they at once begin to feel ravenously hungry with continued injections. This is because HCG only puts abnormal fat into circulation and cannot, in the doses used, liberate normal fat deposits. Indeed, it seems to prevent their consumption. As soon as their statistically normal weight is reached, these patients are put on 800 to 1,000 calories for the rest of the treatment. So I saw on some video, somebody said there was nowhere in Simeons that said there's no amount of calories that you have to eat. Well, looks like 800 to 1,000 for the rest of the treatment after HCG. Okay, the diet is arranged in such a way that the weight remains perfectly stationary and is thus continued for 3 days after the 23rd injection. Only then are the patients free to eat anything they please except sugar and starches for the next 3 weeks. Such early cases are common among actresses, models, and persons who are tired of obesity, having seen its ravages in other members of their family. Film actresses frequently explain that they must weigh less than normal. With this request, we flatly refuse to comply. First, because we undertake to cure a disorder, not to create a new one. And second, because it is in the nature of the HCG method that it is self-limiting. It becomes completely ineffective as soon as all abnormal fat is consumed. Actresses with a slight tendency to obesity, having tried all manner of reducing methods, invariably come to the conclusion that their figure is satisfactory only when they are underweight, simply because none of these methods remove their superfluous fat deposits. When they see that under HCG their figure improves out of all proportion to the amount of weight lost, they are nearly always content to remain within their normal weight range. When a patient has more than 15 pounds to lose, the treatment takes longer, but the maximum we give in a single course is 40 injections, nor do we as a rule allow patients to lose more than 34 pounds at a time. The treatment is stopped when either 34 pounds have been lost or 40 injections have been given. The only exception we make is in the case of grotesquely obese patients who may be allowed to lose an additional 5 to 6 pounds if this occurs before the 40 injections are up. Okay, I'm going to stop there. Next chapter is immunity to HCG. This is an important one. All right, take care.